So this is the next part of the PowerPoint, which is the health journey, through showing how broken and dishonest the Australian health system is. This PowerPoint has hospital records, GP records, therapist reports, but it also has a complaint to the Healthcare Complaints Commission and their response from the Wollongong Hospital. That response from the HCCC highlights how dishonest and broken the health system is. It is riddled with lies on their part, and this PowerPoint is only a few years worth of records and evidence. And it's only a few of the records within those few years. I've gone to hospitals all over the country, as you can see. I've had all kinds of different diagnoses for my problems. No one has ever come close. The closest I've had is I've had one place tell me I've had diverticulosis and another one tell me I have diverticulitis, which is the progressed diverticulosis. And that makes me think that might be what I have, because everywhere is giving me a different diagnosis. I'm developing more and more illnesses and problems because I'm going untreated and having them exacerbated with antipsychotics. Now, this PowerPoint is to show you up until 2003, because since 2003, things have gone out of control and my health has no chance at all. So let's have a look at some hospital records. As you can see, I have been admitted to hospital with pain and vomiting. They have put it down as functional dyspepsia. That was the last diagnosis I had in Sydney prior to going to Daylesford. That was at Ryde Hospital there. Now, here we go. Just showing you some of the symptoms and some of the things I go in for. Chronic insomnia. They put down cannabinoid hyperemesis because that is what I told them my mother said I had when I went to Wollongong Hospital. And then Wollongong Hospital listened to her and just put it down that that was my diagnosis without actually testing me. No one tested me. No one did anything to discover that's what I have and diagnose me. They did it based on my mother's word. So, vomiting and diarrhea, just so you know. Now, if you have a look here, medication ceased during this admission. No drugs, no allergies. Now, they know a million times I said CPTSD. No one knows what it is. They put PTSD. Insomnia and PTSD are both symptoms of CPTSD. Now, right before I went to Daylesford, I was seeing a naturopath who showed me that I actually have these heavy metals. It was lead, mercury, and I can't remember, something else. So these are just showing you I've been in and out of hospital, vomiting, abdominal pain, went and had a gastroscopy. Just showing you. It's just been an ongoing thing, right? In and out. So the Wollongong Hospital, I actually took them to the HCCC. When we first got there, there was a girl who had been in there since 2 a.m. It was 3 p.m. when we got there. She was Indigenous. She was sitting in the back corner of the ED, which was empty. It wasn't full, so it's not like she was lost in the crowd. She had no shoes, no jumper, no shirt or anything. She was wearing just like this little singlet. She was freezing and shivering and shaking. Her arms were slashed up with open wounds that had not been tended or cleaned. No, she hadn't even been triaged or checked. She hadn't even been checked in. She came in an ambulance, got dumped in the room, and no one even registered her at the fucking ED. All these people were coming and going. She just sat there. She had no phone. She had no water. No one offered her a cup of water. She couldn't contact anyone. She was so scared. She was in there for a mental health episode of self-harming in the middle of the fucking night and just left there alone, scared, shaking and tremoring. It was disgusting. My mum arrived and she was triaged within half an hour. So, the Wollongong Hospital. Let's see how many lies. So my mum put in this 28-page letter complaint, and the main 8 things that they responded to were: 1. Use of antipsychotics for mood at ED presentations. The complainant is concerned that these medications each have different half-lives when they were administered. However, Chloe wasn't urinating and was not therefore eliminating the medications, potentially causing them to accrue. Was administration of these medications safe? That has got, yeah, that read funny in the way it was. When my mum challenged the medications prescribed in ED, security was called. Is this an appropriate response? Delay in providing Chloe with pain relief. Chloe was profiled as a drug seeker. Was Chloe profiled as a drug seeker, and were pain relief medications delayed on this basis of the staff judgments about her distress? It's because of how long they fucking left me there. The complaint response said there was no reach proceed in ED. How do patients or families escalate concerns about care in ED? REACH is a protocol available throughout all New South Wales hospitals. It's to get support and help when you aren't getting it in the department where you are. It's to call out, to go above those people and get your matter resolved. It's an escalation process. They have it throughout the entire hospital, just not in the ED. Were communications with family during the multiple ED presentations of acceptable quality from the hospital's perspective? 6. Did my mum questioning of the care provided by ED clinicians negatively influence the care provided for Chloe? 7. There was a Tier 2 emergency response during Chloe's admission. No information was provided. Why was it called? Why was the family not made aware of this at the time? 8. Why was no discharge summary provided at the end of the 8th day Wollongong Hospital admission? So, the response said the Wollongong Hospital was not aware of my mum's employment with or separation from the Islard Mental Health Services. That's their first lie. She told them straight up, and that's when they started getting, attitudes, you can't tell us what to do. They felt intimidated, and they were showing it. In accordance with the Islard processes, the Clinical Governance Unit conducted an initial review of my mum's complaint issues. It was identified at the time that she was known as a former employee to the local health district, albeit under a different surname. Reported that my mum separated from blah, blah, blah. Oh, that's just all about the dates, blah, 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 blah. It explains that Wollongong Hospital was not previously aware of the public interest disclosure as stated in my mum's complaint correspondence. Another lie. Says the purpose of the Islard providing this information is to give context to the Commission's assessment of my mum's 28-page complaint letter. It states that the central focus of the response is me. It says the response will provide an objective assessment concerning the care of the treatment that I received at both hospitals. It says the purpose of the response is to actively participate in the complaint's resolution. And that they're dedicated to engaging in a process to restore confidence in trust. Well, that's a load of shit. Because we told them at the end of it that we weren't happy, and it just got shoved to the side anyway. All right. Hang on, I just forget something oh, here we go. My mum raising allegations of system failures affecting patient care within the mental health system. Sorry, I forgot to read that out before. I wanted to point that out there, that my mother had already put in a complaint about them because of the patient care being affected in the mental health system. Okay, so I presented with clinical abdominal epigastric pain, decreased appetite, nausea, vomiting, emotional distress, and agitation. These are the exact same symptoms I was displaying when I landed on Enki's door. Reported a medical background is comprised of long-lasting PTSD, anxiety, depression, and chronic insomnia. CPTSD, which PTSD, anxiety, depression, and chronic insomnia are all symptoms of. It reports that I see a clinical psychologist regularly to help manage post-trauma. It states that I disclose self-medicating with a variety of over-the-counter sleep-inducing agents for the last 6 months, including 2 to 3 grams of cannabis. Yes, I was taking Restovit and Phenergan and Valerian and cannabis to try and sleep. It stated that I said I'd cease taking the over-the-counter medications as they were not conducive in managing my insomnia. That is correct. I had stopped using the over-the-counters by that stage, but I had let them know about them. I presented to Shell Harbour by ambulance, again, abdominal pain and vomiting. Triage category 4. Here we go. Was assessed by an ED consultant and a provisional diagnosis of cannabinoid hyperemesis syndrome was established. By my mother, you fuckheads! Is a rare condition that leads to repeated and severe bouts of vomiting in individuals who regularly use cannabis over a prolonged period. I explained to them and my mother so many times that this vomiting happens. It happened during the 3 years that I was never smoking the cannabis. I also need the showers when I'm not having vomiting episodes, because it's not the vomiting that I need it for. It's not the cannabis. It's my nerves. I have burning nerves and it sets off so many things within my body, and the only thing to calm me down is heat. A bath, a sauna, a hot shower. But because when you're having cannabinoid hyperemesis syndrome episodes, standing under a hot shower, having it on your abdomen is the best thing to calm the pain and the vomiting for those symptoms. But I need it on my whole body for my nerves. And I was telling them, but they kept ignoring me. So the white blood cell here, I told them that since 2007, every single blood test I have shows a white blood cell count, and they keep saying it's in line with what's going at the time. So here, the treatment, it was just in line for, the presenting symptoms. So because I was vomiting and sick, that's why my blood cells were high. When it was COVID, that's why they were high. When it was winter, I was coming out of flu season, that's why it was high. Every time that I have white blood cells at a really high count, it's because what's going on at the time. How about they've been like that since 2007 and look further, you fucking idiots. So here we go. I got the IV, yep. And then I got Lagactil, an antipsychotic. So they use it for nausea and vomiting. The amount of antipsychotics they're throwing into me for nausea and vomiting. Fentanyl. What's fentanyl? Fentanyl is pain relief that is so fucking strong. It's 100 times stronger than morphine, which I'd already had in the ambulance. It's used for terminally ill patients. It's 50 times more potent than heroin. Okay? So think about all the things I'm getting doped up on. Morphine, opioids, fucking benzos, antipsychotics. And then they're sending me home with it all still in my system, saying that I'm better. So it gave me relief at the time, and they let me go. So then, I came back again. The treating doctor's communication skills to be inadequate. Yeah, because they wouldn't tell us anything. They kept ignoring us. And we got discharged while I was still sick and had to come back. Oh, they've been counseled about that. Really sorry, thanks. The blood streaks, they refused to look in my vomit bag, right? And they kept saying, it's just because you've been vomiting so much, it'll just be from your esophagus or your throat. Now, the reason we kept telling them to look at it, it wasn't streaks. It wasn't fresh. It was a lot of dark brown coffee granule looking blood from the pit of my fucking guts, accompanied with all the bile They wouldn't look at it. It was not red, streaky blood from my throat. It was from my fucking guts. And that is the exact thing I'm talking about. They dismiss you. They write down that they checked. They didn't. They didn't. So then I had to go again. I ended up going to the Wollongong ambulance. Same symptoms. Once again, checked my blood, high white cell count. Once again, she's got cannabinoid hyperemesis. Not going to do anything. Once again, give her more fentanyl, more IVF, more vomiting, more antipsychotics just from the day before and the day before. Symptomatic relief. They gave me a follow-up plan, which was to go to my local GP, don't take any more over-the-counters, which I told him I wasn't, and get a referral to a psychiatrist for my emotional well-being. My emotional well-being, I was already seeing a psychologist. I was cleared for discharge again. They think it was appropriate. We kept asking them to not let me go. They keep saying that I was happy with the plan, but I wasn't. So once again, I represented the same fucking symptoms. Category 4, high blood cells again. Given some magnesium and potassium because I'm starting to show low levels, right? Give me more of these anti-vomiting, anti-nausea. Yep. Safe for discharge. The discharge this time. Follow up with your local GP. Go to the drug and alcohol service. And go to a specialist for the insomnia. I went to the specialist for the insomnia. But why would I need to go to drug and alcohol when I'm just taking cannabis to try and sleep? This same doctor, because it says follow up with your GP, this was in Wollongong. That same GP knew that I was taking cannabis and ended up getting me onto medicinal cannabis while the hospital was telling me to get off it. Avoid cannabis use. So they wanted me to go cold turkey. You've seen what happens with the withdrawals. You've seen how mental I get without it. Because they don't take it seriously as a medication, they just told me to see a fucking drug service and stop using it. Not really understanding what would have happened if I just cut it out of my system like that. Now, during this visit, we also told them, because I was so tired, I was starting to get really blurry and, I was dropping things and I was just so foggy and tired and I was so dehydrated. I had boiled the kettle to make myself herbal tea and I drank the water straight from the kettle. I was not even thinking. It just boiled. It still had steam coming out of the spout. I've picked it up and chugged and I've just gone and screamed. My throat was then closing up. I couldn't swallow properly. It was all sticky. Every time I vomited, it was hurting even more. And I kept telling them, please check my throat. Please check my throat. I can't swallow. It hurts. It hurts. They didn't. And as you're going to see later on throughout this, I ended up with a fungal infection in my throat as a result. Now, they actually said here, sore throat from inadvertently sipping boiling water the previous day. No, I had a scalding, burnt throat and couldn't swallow because I had sculled fresh boiling water straight from the fucking kettle. Report she informed the treating doctor of this. Could not find evidence that the register inspected or examined. Sorry. We were begging. Please check my throat. Please check my throat. Please check my throat. So, then we come over here. Whoop. I go back in again. Via an ambulance. More vomiting and cramping. This is days now, right? Several days. It was day 6 that they ended up admitting me, and I stayed for 8 days. So that's like 2 weeks. Category 3, same. But now here, differential diagnosis included cannabinoid hyperemesis, gallbladder pain, and a tear to the intestinal wall of my esophagus. IVF, anti-pain cramping, yep. Oh, there you go, another antipsychotic. They actually did a chest x-ray, finally. Now, this is where they found that I had sludge, I think. Oh, no, I will go to that in a sec. Okay, so, during all this, because it was like the 4th day or something, I was on the floor, rolling around, crying out loud, wailing in agony, and they weren't seeing to me, and I was just left there for hours. So my mum ended up filming it. She filmed the state that I was in on the floor. She filmed that they were walking past, but she was also filming a lot of the breaches and laws that they were breaking. This was during, COVID, where everyone was required to wear masks and sanitize. And we were watching, I saw a man totally scratch his balls with his, like a nurse, scratch his balls with his hands down his pants and then go and use the computer without like sanitizing. People weren't wearing their masks. And it was a shit show. And she was filming what was going on in there because her position high up in mental health, her job was to identify corruption and breaches and make people accountable. So she was seeing it left, right, and center and started filming it. And they made her stop. Security was called. She was asked to cease filming the content. And it was noted that she was intimidating towards the ED staff. That intimidation was her telling them that she knows their rights, she knows the laws, of them telling them exactly who she is and her role in the hospital, in that hospital, in that whole system. And that made them scared. So they were not happy with that. I was giving more antipsychotics. And they were trying to tell my mum that it was just for the nausea, but there's so many other things you can give for nausea and vomiting. And then you need to actually be aware of all the antipsychotics and things that were building up in my system, and the fact that I wasn't urinating. You know what I mean? Like, these were just building up in my system day after day. So the CT scan detected diverticular disease, which no one told me about. I had no idea until we actually got all this back from taking the complaint through, and that I had fluid on the pelvis and fatty liver. Now, I already knew about the fatty liver because I have been told by a naturopath that my liver is not breaking down fats. It got so bad that my stepdad also tried to start filming. They made him delete it. I was cleared for discharge. Told nil by mouth and to start fluids in the morning with oral meds. Because at this stage, I was still on all their pain meds and everything. And what had been happening is every time I go away still drugged up on their pain meds, as soon as I take an oral med, I would vomit. So they basically wanted me to try it the next day. But if you have a look at everything that I was on, now, so they thought that was actually good enough. I came back again via the ambulance on the 8th. That's the final one where I ended up getting admitted until the 17th. Same symptoms, same drugs. And it says, General Medical Team admitted under their care. They were actually, on this day, on the 8th, They were going to release me again. We refused to leave the hospital. My mother and I said we weren't going anywhere. They tried to send me out the door again, and we said, no fucking way. We stayed there and refused. Then they decided to put me into the MAU. So these are all the things that happen up there. The mental health team, the general surgery, the gastro. They wanted to put me into a referral to the mental health system. I was already seeing a psychologist for the issues that I have. But they wanted me to go and see their psychologists and people and start again. Like, why? I was getting emotional well-being support outside of there. I was there because of my stomach. I didn't need them chiming in, telling me mental health stuff when they are the fucking cause of a lot of my issues. They wanted me to go right into their mental health department. She said no, that I would actually get a referral as an outpatient with their psychiatrist. On the 10th, I was treated with another benzo and olanzapine. And now here, look at this. Combination anti-anxiety medication. Olanzapine is not anti-anxiety. It's an antipsychotic, and it's used for schizophrenia. They're wording this to try and downplay it, that it's not as bad. Sleep hygiene instructions were also explained, enabling a better understanding of controlling environmental stimulus. You guys have no idea. This is not about me having an active mind and thoughts keeping me up. They don't even know why I can't sleep. Even my therapists are giving me the inaccurate information on what can help me sleep. Because people think you have to slow down your mind because you got anxiety. I have a full-blown phobia of bed. Bed is the fear, not sleep because my brain's fast. I have a fear of beds. I get so fucking sick of people telling me how to do things that they don't know anything about. The doctor confirmed that it provided good relief for me as my agitation and physical symptoms began to improve throughout the remainder of the admission. Yeah, it took 8 fucking days. I had a gastroscopy. It revealed that I had basically like the fungal infection in my throat from the hot water and cuts in my throat from like vomiting. My condition improved throughout the 8 days that I was there. With a comprehensive discharge management plan. The treatment and care during this admission was confirmed was clinically appropriate and suitably arranged. I was actually really happy with those people. I sent them a box, a Christmas hamper. It was like nearly $100. I sent them a hamper, thanking them for the way that they treated me for those 8 days. Like a human being with respect that made me feel safe after what I experienced in the ED. So let's have a look at the medical emergency. Now, one of them was just a tier 1, and it was just an anxiety anxious reaction. But this one here, the tier 2, they've lied. They lied on this one. They said that an indwelling catheter, hang on, where was it? Here we go. Visual observations were in the exception of hypertension. Here we go. Psychological response consistent with pain and anxiety. They've lied on here and they've missed out what caused it. They came in and they gave me a benzo. And I said to them, please stop giving me benzos. There are some that I react to. And as they were giving it to me, my arm started tensing up. And I started seizing. My body was seizing. Not having a seizure, like my muscles were seizing up and tightening up, and I couldn't move. And it was getting really fast out of nowhere. And I told them, it's that med. And they came in, they came bursting in. There were people from all different departments and machines and trolleys and everything. And they gave me another medication which straight away brought it down. They've lied on here because I told them not to keep giving me benzos, that I react to some, but I don't know what, and I've had too many. And then I reacted to what they gave me, and they had to quickly give me something to counteract it. They fucking lied in that one as well. So, over here, the treatment provided, especially, were clinically appropriate. She was not contacted overnight. There was no requirement for staff to contact because there was no deterioration. We actually told them every little thing. You need to contact my mum. I'm not giving permission. She's my voice. I was in no state to be making decisions, especially when I have these people who I don't trust telling me what I need to do. I wanted it to all run through her, and I wanted them to tell her of every little change that happened and to update her with everything. But they didn't. So they've said sorry for that. Apologize for not meeting the expectations. The staff have all been interviewed as a result of this complaint. I actually want to show you something here that I missed out. Hang on a sec, I'm going to pause it to find it. Never mind, it's on the next page. That's why I couldn't find it. Okay, so basically, they were telling us that staff were interviewed and counselled, and I think it's just a load of shit because if you have a look at what's on this next page, they confirmed at no point did my mother indicate that she wished to have a formal complaint lodged. Lie. She actually told them straight up that she wants to put in a formal complaint, and she was waiting for them to get back to her. She called so many times. She went through so many managers, so many phone numbers, so many doctors, so many staff, the receptionists. She was speaking to everyone all the time. She made it very clear that she wanted to have a formal complaint lodged, and it was dismissed. They would read that she felt that we were exposed to acts of discrimination while present in the facility and considers this a serious allegation and made a point to ensure it was investigated, confirmed that there was no inevitable evidence to suggest that the staff treated us in a discriminatory manner and provides assurance that this behavior is not tolerated. They made us delete it. So their way of investigating how we were treated by staff was just to talk to those staff. We didn't do anything. Oh, there's no evidence. Case closed. We had evidence. That's why. Now, these laws are fucked up. They tell you that you can't record and get those evidence. And then when you go and dob people in, they say you don't have evidence to support that. Their investigation is to talk to the accused who deny it and then close the case and call us a liar. That is absolutely disgusting. And they reckon that my mum's PID against the service and the staff knowing her role and that she had a previous complaint made in there had no bearing on the treatment. Really? Then how come she had to start filming everyone? Because the way they started treating her changed the moment that she told them who she was. And that I was just getting left there for hours. So we had an online video to address the matter. There was the whole board of them. There was me, my mum, and a board of people in a room. Well, sorry, not in a room, like on a Zoom meeting. And they went over everything, and I was required to speak at the end. I told them that I was not happy with the outcome, that I wanted it further investigated, and I want to discuss a more reasonable outcome. They never got back to us. COVID hit, and nothing else happened. It just got whatever. No one cares. So that's the ISLID response. Now let's just have a look. Got some more stuff here showing you that I have just been in and out of hospital with the same thing over and over again for years. And it's the same. It's just the same. In and out. Get the fluids. white blood cells, antipsychotics, see you later. Now, this one here I want to show you. This was long history of anxiety and poor sleep. Father committed suicide in October. Someone killed her pet camel. No, I was in the process of adopting a camel that died. No one killed her, and she wasn't mine. Like, people aren't even writing accurate notes, you know what I mean? Perceives that noise is amplified and loud, especially when she is tired. So you can see that I was trying to get help for my sensory issues since 2019. Suvorexant is helping with falling asleep but can't stay asleep. It was at the time. I will start a pill. It'll work for a few weeks or maybe a month, and then it stops. Suvorexant is a central nervous system depressant, which is used for insomnia. No thoughts of self-harm. As you can see, back then, I was not suicidal. And she suggested getting earplugs. So I've had these issues going on for a while, as you can see. You know, this is all leading up to Daylesford. Having a lot of concerns from sleepiness and has tried natrazepam, not effective. I can have 4 natrazepams and drive a car. Also, severe pain with headaches and spasms in her neck are all adding to her issues with not sleeping. Only sleeping for 90 minutes at best. When trying to sleep, worries about a lot, and also pain affects qualities of sleep. I don't worry when I sleep. I'm scared. It is so different. I don't lay there going, oh my God, someone's going to rape me. It's not like that. It's in my system. It's in my body. It's a phobia. I am wired and programmed to know that the moment you close your eyes when you're in a bed, a man is going to do stuff to you. I have to untrain that. No fucking pill will train that out of my brain. I had an MRI and it showed that my brain was fine. It didn't even look like I'd ever done drugs. Why? Because cannabis and MDMA are the drugs used for my issues. It's not going to show up as a druggie for those drugs. They would have been fixing what I needed at the time. So I have been in and out of hospital, seeing GPs, trying all the fucking pills. Have a look at this. Sleep specialist hasn't changed anything. I went and saw a sleep specialist. I went and did a sleep study. I actually had my head plugged in with people watching me on a camera the whole time. And it was the best sleep I ever had. So they came out and said there's nothing physical here, it's psychological. No shit. My fear is that the moment I close my eyes, someone's going to do something to me. Why did I have the best sleep ever with no medication that night? Because I knew that while I was sleeping in there with a camera on me, with like 5 or 6 people staring at me, no one was going to rape me. Get it through your heads. You guys aren't listening to people and you think you know everything. Can you tell I just got triggered by reading this? So even here, not vegan or vegetarian. I'm not a vegan. I'm not a vegetarian. But I don't eat meat in my everyday life. I only eat meat when I'm with other people. And it's because I can't be fucking bothered dealing with their bullshit. I don't generally eat meat, which would be contributing to my low iron. I do know that. Now this here, this was from a naturopath. I did a stool test. I had my bloods looked at under the microscope, and I did an Ogliscan test, which is for sweat. The sweat showed those heavy metals that I showed you earlier. But this one here, the stool, it showed for a tumor, right? Now, as you can see here, it says 4.0, so I'm in the clear. But it was actually explained to me that the marker for having the tumor being cancerous is 4.1. So if I had 4.1, I would actually have like bowel cancer or tumor, right? So that means I'm on the cusp. That means I'm high risk. That means if I don't reduce my stress, change my diet, and get my shit together, pardon the pun, I could actually go up on that scale and develop bowel cancer. This was in 2019 or 20. 20. So we're now in 2025, and I haven't had a stool test to be able to tell me if that has changed. And why haven't I had a stool test since? Because when I lost my job in Daylesford, I lost my income, which means I can't afford a naturopath anymore. And GPs aren't taking me seriously to get it done through them. So I have that to worry about because bowel cancer is in my family on my dad's side. His mother had it and survived. His father had it and died. So bowel cancer is in the family. I have every single symptom of bowel cancer, and this shows me that I'm a high risk of getting it. So, as you can see, I have recurring issues with my stomach that have me in and out of hospital. I've been complaining of other somatic symptoms to GPs. I've self-medicated in my teens and 20s. Oh, hang on. And I have not been on drugs since I was 28. I have CPTSD for my whole adult life and have tried many medications. Remember, this is just the last 5 years. It's been going on for 24. And that's what I want to show you here, my psychological report from 2019 to 22. My only diagnosis was CPTSD. That's it. History of trauma related to complex family issues, sexual abuse, previous substance abuse, and unstable relationships. Sexually abused by father as a child. I was 17. Father committed suicide as an adult. Left by mother for 4 years when she was young. Lived as a homeless person together with her father. Told when she was young that her father had kidnapped her. Problematic relationship with mother and relatives. Previous drug abuse lasting 11 years. Severe and long-term sleep problems, fatigue, anxiety, ruminations and overthinking pattern, low mood, irritable mood, emotional reactivity, social isolation, difficulties expressing emotions, protective shell, intimacy fears and trust issues in relationships, major health pain issues related to her stomach digestion requiring severe hospital visits. Chloe responded very well to cognitive behavioral therapy during the duration of her psychological treatment at Blah Family Health. She showed great insight, consistency, and motivation and was willing from the start to take on board and implement psychological treatment concept in a readily way. Over the course of her treatment, Chloe improved her awareness and self-reflection of her cognitive, emotional, and relational difficulties and was able to reduce her overthinking, ruminating patterns, emotional reactivity, irritability, and was able to stabilize her mood over a long period. She also improved her trust, intimacy fears, and general discomfort with other people, and was, during the time of her treatment, able to form a stable long-term connection. That turned out to be the toxic relationship I had in Sydney that I'll tell you about soon. At the time of termination of her treatment, Chloe still struggled with fatigue, major sleep issues, and health issues related to her stomach and digestion. If you have any questions, please do not hesitate to contact me. Actually, I already did tell you about the toxic relationship in Sydney. That was the one who dragged me with the car and force-fed an entire cheesecake down her child's throat to teach him a lesson on greed. She was a fucking psycho, man. As you can see here, I was going to therapy. I wasn't suicidal. I only had CPTSD. I was responding, my emotional reactivity and irritability. I was stabilizing my moods, improving on my trust and intimacy fears. There was nothing in here to suggest that I'm still on drugs, suicidal, angry, raging, none of it, right? By the end of 2022, I was in and out of hospital every couple of months. I was now in Sydney in a very toxic relationship. During this time, my legs started buckling and wobbling. I had a walking stick for hills and stairs. My stress levels were excessive. The last straw was when my ex dragged me with the car, with her child in the back seat screaming for his life. I moved to Daylesford in December of 2022. I went to Daylesford to heal and have stillness. I was working from home, out in the bush. Many days were spent squatting at the computer over a bucket. But I did it. That's why I had a job from home. I had the job from home because even though I had the problems with my stomach, I just sat there spewing into the bucket while I was working. My living situation was not what I had arranged when I went to Dalesford. I was going there to heal and have silence, to do meditation and yoga and neuroplasticity and spend times with my rabbits. I thought I was going to live with one person in a very quiet place, but I actually went to a share house with a Kelpie puppy that wasn't trained, who kept, scaring my rabbits, running off with my phone, destroying all my stuff, and made my sensory issues so bad that I couldn't leave the room and I couldn't do anything that I needed. And I went a bit fucking scared in there to go out into the world, because I had a person out there who was on my ass telling me that I was doing everything wrong and was just really like a cunt. And then I had the man who was living there. He was really nice. He was actually a really nice guy, but he was loud and he was banging all the time, and that was fucking with my sensory. And then every time I went out the door, that dog would come charging at me and run off with my stuff. It was just fucking with me so much that I ended up getting so affected by the triggers that I couldn't do what I was doing. I started seeing a herbalist who isn't actually from Dalesford, but does consults twice a fortnight there at Enki Apothecary. She had me on a protocol that was working. She put so much time and effort into all my issues and was even helping me with community and self-worth. I wasn't just going there for my stomach. You're going to see in the next PowerPoint about Dalesford all the things that she was helping me with. And you're going to see all the things that happened, all the lies from them, the police, all the things throughout the court hearing, all of it. It went on and on and on. She actually had me on things that were working. I felt things that were transforming, and I felt safe for the first time in my life. I had so much gratitude for their whole team because they restored my faith in humanity and in the possibility of actually healing my symptoms. But it turned out to be a fraud, and because they weren't just helping with my health, you're going to see how damaging it is actually when people take on something they're not qualified to do, when people aren't honest, when people don't do their job properly and gaslight. It doesn't just affect one little thing. You're going to see how it really ripples on and causes so much damage and just completely destroys a person's life when they're sick. So this was the last therapist I had prior to Dalesford, to show you where I was at when I arrived in Dalesford. Chloe was a 40-year-old single homosexual female. I just want to point this out. All of my therapists up until this were Caucasian. The first Chinese therapist I have has to point out on my report that I'm a homosexual. And I found that very interesting, because in China, homosexuality is a mental illness that they are still trying to treat their kids for, and it shames the family. And none of my therapists have ever needed to put it on there. But then I get a Chinese one, and it's included on my mental health report. I just found that very interesting. Who initially presented to therapy for insomnia and trauma symptoms. Chloe had a history of recurring functional dyspepsia episodes, characterized by symptoms of stomach pain, severe nausea and vomiting, which resulted in significant weight loss and reoccurring hospitalizations. Significant weight loss. In 6 months while I was in Sydney, I was actually overweight. My ex, that psycho, I don't know if you know this, but Muslim women, are feeders. They love to cook, they love to feed. I got fat. Well, actually, I got chubby. I was 86 kilos. I went down to 53 in 6 months. I lost 33 kilos in 6 months, and that's why I had a walking stick when I was going up hills and stairs, because my legs kept buckling and it was just so severe. Chloe had a significantly traumatic childhood marked by abuse, violence, itinerancy, and homelessness. She had a familial history of mental illness, as her father had schizophrenia and completed suicide. Chloe had an itinerant lifestyle throughout adulthood, moving around Australia and other countries every several years. She had a history of heavy alcohol and drug use in her 20s. I'm 41 now, Dalesford. Chloe reported a recent history of using psychiatric medication, olanzapine, to help her with her sleep and or medicinal cannabis products for insomnia and functional dyspepsia. See? Medicinal cannabis products that I was on when I get to Hobart, Daylesford. In the last therapy session, Chloe was working on weaning off medicinal cannabis use because Enki were weaning me off it with their products. Chloe attended 12 clinical psychology sessions every 2 to 3 weeks between September 22 and February 2023. Although she initially sought therapy to address her active trauma symptoms, the focus shifted towards helping her navigate the breakdown of her volatile romantic relationship at the time and grief over it. The therapeutic approach combined schema-informed and cognitive behavioral therapy, targeting her tendencies towards avoidance coping, self-sacrifice, feelings of inherent defectiveness, and strong self-blame. This is how I arrived in Daylesford. So this anger, this rage, and all this blame you see now is because of what happened in Daylesford. I wasn't like this in Daylesford. Chloe ended therapy prematurely because she wanted to completely sever any association with her ex-partner and the ex-partner's child, who were also receiving therapy at the same psychology practice. She would greatly benefit from further psychological therapy. Now, that's the state I arrived to Daylesford in. I actually started seeing a therapist in Daylesford. I don't have her thing on here. But I do have, in the next video, which is going to be about Daylesford, and then the court hearing, and then my health journey since to now. The therapist who I saw during the court hearing and all the stuff that happened is going to show you basically the before and after on my health, mentally and physically and emotionally, with what happened in Daylesford, with the police, the specialists, and everything. And why am I doing it? To show you how people are affecting people with trauma. We aren't going untreated, we're getting made worse. So you can see here that I have had issues my whole life with my stomach, with the vomiting, the nausea, the guts. And I've been in and out of hospital for it. I've had all these different diagnoses. But mentally, I've only ever had CPTSD until Daylesford. So our system is not at all paying attention. They're not honest. They're not listening. They're not treating people. They're actually just guessing. They're lying. They're cutting corners. They're just making shit up and just to get you out as quick as they can. And then as soon as you call them out on anything, they will gaslight you. They will blame. And they will do anything to cover themselves. They are so dishonest. And I will never, ever, ever in my life go to a hospital or a GP in this country again. Never.